Yes, this consumer question is great. How does consumer IT start to impact healthcare? I think it's going to be a huge impact, starting all the way from employees coming and expecting from their employers, whether it's a hospital or a clinic, to say that they want to be able to use Facebook, or they want to use applications that are friendlier. They want to use their mobile phones to do their and accomplish some of their work tasks. They want to use more friendly tool sets, all the way to actual consumers like patients who are coming in and demanding that they not have to fill out yet another form when they've got data that they just gave to the previous physician. That when they come into an institution, they want to be able to have simple things like Wi-Fi, so they can keep their loved ones in communications and let them know how things are going. So I see that you may have heard of a movement called BYOD, Bring Your Own Device. This was almost unheard of about 10, 15 years ago, because the devices that we used in an office setting were those devices that were provided by the office setting. You came in, if you wanted to watch TV, you watched whatever TV was on the screen. You wanted to convey something to someone, you wrote it down on a sheet of paper on a form and you handed it to them. Now we're seeing that the entertainment that you get when you're sitting in the waiting room, the communications that you want to do with your hospitals and doctors, etc., are happening on your terms. Meaning in this case, if you're a patient. So the consumer movement is huge, and we're going to see major impacts and major changes. And we've already seen a lot of it in the more advanced institutions, understanding that BYOD, Bring Your Own Device, and these consumer grade technologies such as cloud-based applications, mobile phones, etc., are and should, and it's great that they are adjusting the workflows, adjusting the way that we speak to and work with our patients and consumers and employees. So I think it's going to be a big movement, and it's going to just get worse and worse. So from a human resources side, it's really good as if you're a expert at or know a lot about consumer health or consumer IT. You're coveted right now, because most vendors want to know how do they write applications that are more consumer friendly, more friendly to younger audiences, more friendly to people who are accustomed to using everyday cloud-based tools rather than 20-year-old enterprise IT kinds of tools. So if you're on the consumer IT side and you're looking for a job, this is a great time to be posting that kind of experience on your resume and on your job profiles.